Lifespan development. How many of you guys have grandparents? Pretty good. You had grandparents. How many of you have brothers and sisters? How many of you have younger brothers and sisters? How many of you have parents? Pretty much got everybody there. Okay, so this will apply to just about everybody in here. So let's see what all we can identify with. We're going to look at different aspects of the aging process. And when we talk about aging, that sounds like old people. But even, if you're one day old, soon you're going to be old and you're going to be 10 days old. It's like nothing like a little 2-year-old that goes, man, they're really old. Yeah, she's 4. So it's a process. We're going to be looking at the physiological components, meaning how we physically change over time. We're also going to be looking at the psychosocial, or the mental aspect, and the social aspect, the emotional aspect of development. I'm sure many of you have known people that are big people, large people, but they're very young. I know we've got property up in South Carolina, and people live across the street there. They have the boy's probably 8 now, but I first met him when he was about 4, and he was about 5'5" then. He was just huge. I thought he was a really big person, but he was a little boy. So sometimes you're going to have to look at that too. It's not just their physiological development you'll be looking at, but you're also going to be looking at their mental and social development. And these are going to vary based on their age brackets. Now these are the breakdowns that you need to be familiar with. They're easy. You know all of these. Infancy is birth to 1 year. And while we're here, let me write out something else for you. We even break down infancy a little bit more. This is so funny. What's the age range for newly born? Newly born is the first 24 hours. My daughter had a newly born last week. And let's see, any guess about a neonate? Well, 30 days, 1 month. So in that first month of life, we call them neonates. In the first 24 hours, we call them newly born. And then anything from 0 up to 1 year is going to be infant. So our sometimes our infant things are different than our newly born things. And we'll look at that later in the semester. Oops, wrong thing. The toddler phase is going to be 1 to 3 years. That's going to be the terrible twos, sort of. Preschool is 3 to 5, the kindergarten, preschool, that kind of stuff. School age 6 to 12. Adolescence 13 to 18. Then we're going to break down adulthood into 3 phases. Early adulthood is 19 to 40. Middle adult 41 to 60. Late adult 61 and up. Let's see who's got the oldest grandparent in here. Or who had the oldest grandparent if they've already passed away? Anybody got grandparents or had grandparents that lived in their 90s? That's a lot. That's half the class. Isn't that shocking? How about over 100? Wow. Boy, you better just dig in for the long haul. You're going to be oldie golden, huh? Wow. I don't want to live that long, I'll tell you. I shouldn't say that in here. Y'all might kill me. Yeah, back in the olden days, people didn't live that long. You got to be 60 and you were ancient. Now these old people are living to be 100 years old. And who's going to be taking care of them? You. Anyway, so that's how these break down. So let's get ready for infancy. Isn't that a cute little baby? I love that little picture. The physiological characteristics of newborns, basically, is what we're looking at here. They're going to weigh approximately between 6 and 7 pounds at birth. Most of them are normal. Actually, most of them are about 8-pounders these days. They're having these huge babies. It's amazing. But at birth, they'll be 6.5 to 7.5 or so. And they should triple their birth weight by 1 year. So by 6 months, they've doubled it. By 1 year, they've usually tripled it. So if you're trying to project that, or if you've got a kid that weighs 28 pounds and they're 1-year-old, how much do they weigh at birth? They're pretty heavy, huh? Pretty heavy. The head, this is important, the head represents 25% of their body weight. You know, you've seen them, a little bitty body, and a big old head. How can that be a problem for us? Yeah, number one, it's so heavy, it's really floppy. They don't have the musculature to support that big old head. Also, if mom's off balance, you know, she drops it. What goes head first? Head first, because it's got the big old head. Another aspect, their airway is not as stable as a grown person's airway. The trachea is narrow. It's not very firm in there. It's more flexible, so it's more easily blocked. And we'll talk about that at length a little bit later in the semester. Their nose and diaphragm are used for breathing. So they are what we call obligate nose breathers. And that's a term you want to be familiar with. That's not a writing thing. Obligate nose breathers. Which one of these can y'all see better on? I know it's not. Right here, can y'all see it? Okay. This is one I can spell. They're obligate nose breathers. So given the choice, they're going to breathe out of their nose. So one of the first things that we're going to do as we deliver a baby is we're going to suction out their airway, first their mouth and then their nose, so that they can breathe. If you get a little kid that's got an upper respiratory infection and the nose is stopped up, they're going to have a difficult time breathing. Another thing that you'll see too is they are diaphragmatic breathers. They use their diaphragm to breathe. And the diaphragm, while it's one of our major breathing organs, what it does is as it flexes, it pulls the rib cage down like this, so you'll see their little abdomen moving as the diaphragm goes down. But they haven't really built the musculature in the rib cage in order to expand. Like for us, you can always tell when somebody's breathing, they go, the rib cage goes out. You don't really notice the abdomen so much, even though the diaphragm is very active at that point, but you don't notice it as much, but you'll notice the chest going out. With these little guys, the chest doesn't go out, so you may not see their breathing like I would see your breathing. So you would have to watch their stomach to see their little abdomen come and go as they're taking their breaths. Another thing about the little newborns, they get a lot of antibodies passed during pregnancy from their mom. So we don't see a lot of illness in very young babies. You know, 1 to 3 months of age, it's unusual for them to be ill. They also receive a lot of antibodies through breastfeeding. If you want a healthy child, the best way to assure that is to breastfeed your child. Okay, there are 3 other things that we'll notice specifically with children, things that they do, these little newborns, and you've seen them all. The moral reflex, you know, if you scare them, like I stayed with my daughter Sunday night after she had a baby, and I went into that bathroom, I mean, the door is like huge, and it's like moving Fort Knox or something, and I closed that door, and the baby was just laying like this, and I shut that door, and it went, you know, like you electrocuted him. That's the moral reflex, the startle reflex. There's also the palmar reflex. What do you think that is? Yeah, you know how they kind of grab on your hand? If you put your hand here, they'll grab it. So cute. Palmar reflex. And then the rooting reflex. Have you seen that one? You know, if they even get anywhere close to your chest, you know, they start doing this whole number. Yeah, but if you stroke their cheek, they're going to turn towards you. It's like if they're feeling mom's breast, they're going to turn towards that. So that's going to be the rooting reflex. Other things, the sucking reflex. If you touch their little lips, they start going. Have you seen that? Yeah, y'all have all done that, haven't you? You walk the babies in the nursery and go, looks like they're blowing you kisses. Now, their sleep patterns are good and bad. They sleep a lot, but they seem to wake up every 2 hours for a while. It's pretty bad. After about 4 or 5 months, usually they're sleeping through the night fairly consistently. If you're lucky, it's 6 weeks, but nobody has that kind of luck. Their extremities grow from a combination of growth plates and epiphyseal plates. So we have to be very concerned as the children grow that they don't have injuries to their growth plate, particularly in their knees and elbows and wrists. Other things, and this is important because I know you'll see this because Roshri likes these. Babies are born with fontanelles, which are going to be little soft spots where the plates of the skull have not fused. Why do you think we would have loose plates in there? Why is it important if they flex like that? Do what? Yeah, as they're going through the birth canal, it can be kind of tight in there. Very kind of tight, and so those allow for flexion of the skull so that it can be delivered. You've seen the little cone heads, you know, they're all shaped funny like that because they're specifically not fused so it can pass through the birth canal. So it's kind of a handy thing. And so then as they start to grow, what's another reason that they don't fuse right away? You know, some changes take place right at birth, but this one takes, 18 months before they start fusing well. What's the purpose of waiting until you're 18 months old?
The brain grows right.
Yeah, that brain, that big head, we want that big brain to grow in there too. So by the time they're 5 years of age, they've got almost full growth of the brain. The brain's the full size that it's going to be. So they got that big old head, they got that hopefully big old brain coming along in there. So yeah, they've got fontanelles. We've got one in the back of the head, and that closes much more quickly. We've got one on the front that usually may take up to 18 months to close. But so the bone is not under there, but you basically just have tissue. You have a membrane over there. It's kind of like, you're pushing on your arm or something. It just kind of goes down for a while before you hit the brain. So it doesn't have a whole lot of protection, which is not good. One of the purposes that we use these fontanelles for is we will look at them, and if they're swollen and bulging out, we're going to suspect that they have some type of infection, meningitis possibly, because it will bulge out from the swelling that occurs inside the brain. Sometimes they may be sunken in. If you look at that little fontanelle spot, it kind of has a depression. That's going to indicate that the baby's dehydrated. And kids can get dehydrated very rapidly. Pardon me. They lose a lot of body fluid. So bulging fontanelles indicate increased pressure inside the skull. Oops. And then depressed indicates dehydration, most commonly. Okay, psychosocial characteristics. These are probably the ones that you're going to be most familiar with. Little guys, and these are a few stages. They're very hard to remember. Bonding. Kids need to know that their needs are being met. Every time they cry, mom comes and gives them, something to drink, gives them milk. So that's bonding. When they scream, mom or whoever cuddles them up and makes them feel secure. That's bonding. They also are going to learn about their environment, where they can trust their environment or not. And a lot of that is going to come through consistency. If they always get the same response, in certain situations, then they're going to trust that that's always going to happen. Little kids do much better if they're on a schedule. They know what's going to happen and kind of do the same thing. And it causes them to trust their environment. If every day they get up, there's always something different happening, it's more confusing for them because they don't have the experience that you have. Now for us, we probably like things to change every day. Well, some of us do probably. Others, you just like things to be, always consistent. But with little guys, they really need to have a predictable environment. It helps them to develop trust in everything. Scaffolding, and that's one, we use that in here too. Scaffolding is a way that you learn based on stuff that you already know. So we lay a foundation and then we add stuff to it. We kind of spread that out, work on that, and then we add more stuff to it. Kids learn like that. Everybody learns like that. So that's what scaffolding is. Temperament. Temperament is going to be the child's normal reaction to their environment. Some people, if you think of this as people that you know, some are just always cranky. Some are just always in a good mood. So they're going to develop a temperament. Oftentimes you'll find that the temperament develops a little bit better if they have a more stable environment. They act a little bit better. Okay, let's look at toddler phase. These are the 1 to 3-year-olds. Cutie pie. Okay, their pulmonary systems are increasing. Their bodies are growing. They're developing more alveoli. The respiratory tract is getting more stable. The nervous system, as I mentioned a second ago, that their brain reaches almost adult size. By the time they're, this said 3 years old, they've got 90% of the brain's adult weight. By 5, it's fully formed. got the whole, that's why their heads are so big. You'll notice that they start developing muscles. What happens during this age range from 1 to 3 that causes them to greatly increase their muscle mass? Yeah, they start running around. Once they start doing that, they can do a lot of stuff. You know, they develop that strength in their legs. What happens to their upper body? They get that climbing thing going. So yeah, they're developing a musculature, which helps a lot. That's when they move from being a diaphragmatic breather to being able to increase their breathing through their rib cage, because the muscles between their ribs. Their bone density increases also. The immune system, they become more susceptible to disease. And why do you think that is? Well, there's much greater exposure to it, right? They're out in the world, they're grocery shopping, they're gnawing on buggy handles, they're picking their nose, they're doing all kinds of really gross things. So yeah, they're much more prone to illness at this point. And then we start the vaccination process to help prevent some other illnesses. They start getting their teeth. By the time they're 3 years old, they usually have a whole set of teeth. It's really weird. 3 years old, just about got all their teeth. Not their adult teeth, but got teeth. Now they're psychosocial. They start to understand things. From 1 and 3, they develop a pretty daggum good vocabulary, and they will let you know what they know. They understand a whole lot more than they can explain or than they can see. They start learning cause and effect. That's kind of cute. They're very curious, as you know. We call them the terrible twos, but one of the reasons is because they're into everything, so they're very curious. When you're busily child-proofing your home, you need to make sure you get down the level of a 1 or 2-year-old, because they see things you don't ever see. I mean, I've not seen the underside of a desk since I was probably in kindergarten, but those guys see every piece of gum you put up under there, and you pull that gum out from under that desk? Yeah, it's good. Yeah, so they see things that you would never see. It's kind of like your cat. Your cat can find something on the floor, so they'll find it if it's down there. So recognize that they are very curious. So when you're doing an assessment on a child, say they have a blocked airway, you start looking around for what they could have choked on. Or if you're looking up on the tabletops, you're not going to find it. It's rolled up under the couch somewhere. They also have separation anxiety, and that's going to alter the way we interact with kids because of this issue. Sometimes we leave well enough alone, just let mom hold the child, and then we're able to auscultate their lungs, listen to their lungs. We're able to check their pulse. We're able to palpate them, touch their body, and see if they're injured anywhere. So they'll let you do that if they're sitting in mom or dad's lap. But, if you're saying, come here, kid, and you start mashing them all over, what are they going to be doing? Screaming bloody murder. Sometimes you're going to have to separate them from the parents if they're very ill. But otherwise, if that happens, they're not going to care. So that's always a tip to you, to tell you how bad they are. If they're screaming bloody murder when you try to remove them from mom, what do we know about them? They breathing, they got a pulse, right? That means they're not fixing to die right now. If they're real listless and they allow you to take them away from mom or dad, they're sick at this age. They don't want that. Kids at this age range start making up things. They call it magical thinking. It's lying in its purest form. But they do the whole role play. They dream up things. They're princesses. All the girls are princesses. I don't know how they're born with that. And all the boys drive trucks. I know this because I have grandchildren. They're so cute. Preschool age, 3 to 5. What a nice age. Their body systems continue to grow. They're getting taller. Their systems are getting more mature. They begin to form relationships with other people. Their social skills get better. They interact better. School age, 6 to 12, it's a fun age. They learn to ride a bike. They're going to lose all their baby teeth and get in all new ones. It might take a few years to get all the new ones in, but you've seen them. They're about 6 years old. They're starting kindergarten. They just, all I want for Christmas is my teeth, front teeth. Remember that one? Y'all didn't know I sang too. Psychosocial, these are kids you might be able to let them out in the backyard and play by themselves. They might be able to go back into their bedroom and play unattended for a little while. That's always nice. They they start making decisions for themselves. They start learning how to weigh things, the good and the bad, the right and the wrong. And they become more aware of self-esteem. Interesting. They start being impacted by the opinions of their peers. So peer pressure starts entering into the equation about here. Adolescence, we have children that look like adults. Many times they're in adult bodies, but you have to recognize that they still psychosocially are teenagers. They want you to treat them like they're adults until something really bad happens, and then they want to be treated like a child. You'll notice oftentimes you'll have a growth spurt. We see this a lot with young males around 12, 13, 14 years old. They'll grow, about 12 inches from one summer to the next. They become sexually mature physically, maybe not emotionally, and they want to be independent. As they move up in the teens, they want you to leave them alone. They're also very conscious of their body image. They don't want to be disfigured in any way. I mean, you may have run an accident where, they're teenagers in there, and say you've got some guy, some female actually, who's got a bad cut to the face. They're not worried that they're going to bleed to death. They're not worried that they're going to die. They're worried that they're going to have this scar here for the rest of their life. So body image is very important, and peer pressure too, unfortunately. They also are prone to self-destructive behaviors, only they don't think they're self-destructive. They're only self-destructive when they self-destruct. They think they're invincible. Does that fit anybody here? No. Nobody in this class, I'm sure. But yeah, in this age frame, they think they're invincible. They don't recognize that those risky behaviors can actually kill them. It's like, man, how did that happen? They start developing a code of ethics. They know what's right and wrong. And they start to be able to evaluate, should I or shouldn't I? Why is this right? Why is that wrong? What should I do morally? So that's a great thing. Adolescents are often injured because of risk-taking. Yeah. And sometimes they don't want to tell you what really happened. So they have a tendency to not tell the truth, possibly. So you may have to help them along with that. So if you're having to interview, say, a 17-year-old who just ran his truck into a tree, but he's okay, and he's out and you're talking to him and you ask him what happened, what kind of things would he want to omit? I was drinking a little bit. I was texting. I was on the phone. I was driving too fast. Yeah, so you may have to elicit some of this. Say, I'm not law enforcement. I'm not the police. I don't turn you in. But I do need to know the circumstances so that I can help you. If you've got a patient on drugs or they've been drinking a whole lot, they're having trouble staying awake, you need to know if you're looking at a head injury or you're looking at a guy that's got, a fifth of vodka on board. So you need to find out from them. If they've been taking drugs, I don't care that you're taking drugs. I mean, I really do. I don't care that you're taking drugs. I'm not going to report you. I'm not telling the police. But I need to know so I can treat you properly. Usually if you take that attitude, they'll tell you, except if they're around a big group of people. So you may have to pull them aside to do that. Early adulthood, 19 to 40. This group is when lifetime habits are formed. You get in a consistent pattern. You're finished with school. You're out. You're working. This is also a very stressful time in people's lives. They're getting married. They're having kids. They're buying a house. You got to pay off the car. I've got $50,000 in school debt. All sorts of stressful things. They're also at their peak physical condition at this point. So most of these patients that you have in this age frame, what are you seeing them for, most likely? Accidents, traumatic injuries, more times than not. Most of the time you're not seeing heart attacks. Has it happened? Sure. You usually don't see strokes in this age group. It does happen, but not nearly as common as traumatic injuries. Psychosocial, I mentioned they have a lot of stress. There's a lot of things going on. Accidents are going to be the leading cause of death for this age group. 41 to 60, physiological. Many times they're wearing glasses. I remember as a kid, my eye doctor says, you know, by the time you're 40, you're going to be legally blind. Okay then, thanks for that. But what he was telling me is everybody just about is. They're all going to have glasses by then. Cancer and heart disease are starting to increase in this age population. Weight control is much more challenging for them as the body slows down. Psychosocial, a lot of these are going to have the empty nest syndrome. You know, their kids are going off to school. Some of them are going, I'm going, yay. Not really. They oftentimes are caring for elderly patients, elderly parents on one end, and then their kids that have returned to the roost on the other end. So they can have that sandwich generation, I think they would call it that. 61 and older, the body systems become much less efficient. And this is important, and one thing you need to understand, we're at your peak probably around 25 to 30 years of age. Not really yet. 25 to 30. That means that all of your body systems are firing on all cylinders. But for every year past age 30, you lose approximately 1% of the functioning capacity of each body system. And that's even if you're in the best health you can be. So say at age 70, how much loss of your respiratory capacity would you normally expect for a 70-year-old? Now, guys, about 40%. That's significant. And those are your healthy people. If they have respiratory disease, it may be less than that. Cardiac function. At 30, everything works great. At 70, they've lost about 40% of the functioning capacity. By that, I mean their vessels don't expand and contract like they're supposed to. Their blood doesn't flow quite as well. They don't have quite the volume of blood that they had before. They may not produce as much hemoglobin as they used to. They may have other issues like that. What are some other body systems you can think of? The kidneys. If you lose 40% of the functioning capacity of your kidneys and you don't have kidney disease, you know, that's why so many old people get up and go to the bathroom in the middle of the night. Because kidneys just aren't working so good. How about the nervous system? You know, things just don't fire like they used to. Everything slows down. So when you're doing assessments and treating your elderly population, you got to recognize that even the healthy ones are going to have some diminished capacity there. So appreciate that. And then when you guys get old, you know, remember this, okay? Psychosocial. For this age group, their living conditions are going to be very different. Most people at age 60 to 70 are living independently, you know, with families and that kind of stuff. As they get older, you're going to have more of them that move into nursing homes, or they move and live with other families. So the living environment is going to be a little bit different based on how far they are into that. Their self-worth, this can be challenging sometimes for your older population. For instance, what are the groups that we see the highest suicide rates? Are these that we've looked at? Who do you think is at the top of the list? Yeah, pretty much the adolescents. You know, they've got those self-worth and that image thing. It's very disturbing for them. You know, what's the second group? You might think that. It's these old guys. You know, they've lost their spouse. They've been married for 50 years. Papa died, and, you know, they're alone. They don't feel like they're worth anything anymore. They're not raising kids. They're not training kids. They're not in the workforce anymore. So sometimes they have that loss of self-worth. So we do see a fair amount of suicide in this age bracket. And I will say this age group is more successful at suicide than the adolescent, really. But we see a lot more attempts in adolescents than you do with the older ones. You also see financial burdens. And this is something you're going to see a lot as you all get older, where that middle-aged people that lost so much in this most recent financial crisis, they've lost a lot of their savings and their retirement funds. So you're going to be supporting a lot of those old people that lost their money back in 2010, whatever it was. So a lot of financial burdens. So what type of impact do you think that's going to have on some 75-year-old lady? She barely has enough money to pay her light bill, and you've been to her house 3 times in the last 2 weeks, and she's not taking her medications. Why is she not taking her medications? Possibly she can't afford them. Why else is she not taking her medication? She forgets. Why else is she not taking her medication? She just don't want to. That's a possibility. Yeah, there are a lot of reasons that they're non-compliant, and they're usually not just because they're stubborn, but sometimes they can't afford it, they get confused about it, they can't remember they took it, they take too much, they thought they took it, and they didn't, whatever. So a lot of things going on there, but financial burdens is a big deal for them. So it's not unusual to find your elderly, your very elderly patients that are living in homes that the power's been cut off, or they don't have the money to run the heat, so it's 30 degrees when you go in there. So when we talk about being a patient's advocate, that's where we really come into this game, because we see people how they live. You know, if the patient just appears in the ER, I mean, what does the staff there know about Granny? She's 75. They don't really know except what you tell them. If you say, we found Mrs. Jones, her house was around 40 degrees in there. There was animal feces spread all over the house. She had stacks of dishes, you know, backed up in the sink. There was TV dinner trays laying all over, and she hadn't been out of bed for 3 days. That says something completely different than, here's Mrs. Jones, she's got a cold. You know what I'm saying? Other things that this age group is looking at is death or dying, and that frightens a lot of people. And, you know, once you're 75 or 80, or, you know, in Lisa's case, 100 or 110, you know, that's something you got to look at, that it's there, and it's going to get everybody. All right, let's see what we can remember. You got to recognize in each age group the differences between their physiological development and their psychosocial development, because it may not be consistent. Because it's important that you know what is the norm for each one of these age groups, because if you're interacting with a 4-year-old, do you expect them to be wearing diapers? No. So if you walk in, you've got a 4-year-old in a diaper, that's going to tell you some things, different things than what it would tell you if they just were in their regular clothes. So you've got to be able to recognize what the expectations are at each age level. Infants and young children have less developed, smaller respiratory structures, which can worsen respiratory condition. You know, if they've got a trachea about the size of my finger, it doesn't take much to block that. The trachea is going to be your airway down to your lungs. So about this size, if that gets blocked, they're going to die. They're going to suffocate right in front of you. So a small amount of swelling, a small amount of peanut butter, you know, a small coin can block that airway. But for us, we could walk around for days with a clump of peanut butter in our throats and we never know it. Make sure that you communicate with each patient based on their age group. You know, you're going to talk to a 70-year-old differently than you're going to talk to a 4-year-old. You're going to talk to a 20-year-old differently than you're going to talk to a 50-year-old. So make sure that your communication is age dependent, but also make sure your communication is appropriate for each patient. You know, if you go into some little guy that has a 6th grade education and you start talking about obligate and, you know, big words, he doesn't know what you're talking about. So that just makes you very rude and very inconsiderate. So you want to talk to them on their level. If you walk in and try to talk to a physician and say, okay, now I'm going to take your blood pressure, is that okay? He's going to go, bye, I'm calling somebody else. So you have to keep your communication appropriate. Recognize that little kids may have a fear of strangers. So you're going to scare them. You've got a uniform on, and if they've heard or seen, if they watch TV, you know, they might be frightened of you. They may have separation anxiety for the little ones. The older ones get embarrassed. You're really old, you're elderly, sometimes are in denial. No, I'm not really sick. I don't know why they called 911. Why are they doing that? Well, they don't want to be old, but you know, I don't want to go to the hospital. People go there and die. I don't want to go to the hospital. I can't afford it. I don't want to go to the hospital if my family finds out, you know, I've gone to the hospital again, they're going to put me in a nursing home. So if you've got a patient that's sick, see if you can't figure out what their deal is, just like we talked about last night. A lot of depression in the elderly. Although preschoolers begin to develop independence and reason, they still resemble the psychosocial development of toddlers. Kind of say that about teenagers sometimes. School-age children are independent, logical, but if they get hurt, they revert to a 2-year-old. Kind of like 14-year-olds, they revert to a 2-year-old. Okay. All right, ready? You're called for abdominal pain in a 16-year-old girl. Now, when I read you these scenarios, I want you to try to picture it in your mind. Conjure up that 16-year-old girl in her home, sitting on a chair, wherever you want to do it. So you get called for abdominal pain in a 16-year-old girl. She is with friends at the park. Hey, you see that? She seems hesitant to answer any of your questions. What are you thinking about? What you going to do? Is that the question here? Yeah. Do what?
Like asking in private?
Yeah. Try to separate her from the friends. Why is that important? What's the issue here? Peer pressure. She's embarrassed. She may have some sensitive information she didn't want to share. She wants her friends to know she's got a problem. Is there a possibility she could be pregnant? Certainly. She doesn't want to talk about that in front of her friends. So separating her from her friends will be the best way to do that. So how would you do that? You say, well, come over here and let's talk in private. You think that's... Who has a better idea? Back up, Jack. I'm thinking it. How about, instead of making it look like we're separating her, say, I've got my blood pressure cuff, my stuff in the ambulance. Let's come on into the ambulance so I can go ahead and take your vital signs. So that's a perfectly normal appearing way of separating her from her friends without making it that obvious. Okay, that wasn't too bad. It's 20 minutes to 7. If anybody's had trouble with Canvas, we need to get you on there because there's some activities on there. There's a VART quiz on there. I want you to do those by the weekend.
Due by next week.
Yeah, it only takes a minute. Yeah, we'll have some other things coming up. There's a couple of discussion questions on there too. I want you to respond to those. If you're not getting on, you're not discussing. Okay? Will y'all be safe over the weekend? I don't want to read about you in the paper. I want your little shining face here on Tuesday. All right, have a good weekend.
It was a 13.
Oh, okay.
I just threw that.
Hey, come on. 13, superstitious.
He is a little, yeah.
Really?
See him.
All right, thanks so much.
I go to get him out.
Yeah, they're probably.